Welcome to the CareClinic Pod. I'm Emma, and this is Jones.
Hey, everyone, and welcome back. You know all that talk about the baby blues, that overwhelming feeling so many new moms mention?
Yeah.
Well, what if I told you that for 1 in 5 of us, it's not just the blues.
Right.
It's actually postpartum anxiety. And it's way more common than you might think.
It's true. And often, so many new moms just kind of brush it off, thinking it's just part of, becoming a mom and all the adjustments.
Right.
But postpartum anxiety is a real condition.
Yeah.
And it can be incredibly tough to deal with on top of, everything else that you're going through.
For sure. It's like you're already on this emotional roller coaster and then, bam, anxiety just throws you for another loop.
Yeah, yeah.
So for all the new moms listening out there, or anyone who loves a new mom, let's break down exactly what postpartum anxiety is and what you can do about it.
Absolutely. So first things first, postpartum anxiety, it isn't just like typical new parent worries. We're
Yeah.
talking about intense, persistent fear and worry that can just feel like all-consuming.
Right.
Yeah. It's like your mind is constantly racing with what ifs.
Oh, yeah.
Even when you know your baby is perfectly fine.
Okay, so it's more than just being a little stressed, right? It's not just in your head.
Right.
There are physical symptoms too.
It can manifest in so many ways. You might feel constantly on edge, have a racing heart,
Right.
or even experience dizziness and nausea. Some women even have panic attacks,
Wow.
which can be terrifying.
That sounds really intense.
Yeah.
It's definitely not just the baby blues.
Exactly. Baby blues usually fade after a couple of weeks,
Mm.
but postpartum anxiety lingers
Mm-hmm.
and can really interfere with your ability to enjoy motherhood.
Right. So how is postpartum anxiety different from postpartum depression?
That's a great question, and they often get confused. With postpartum depression, the focus is more on feeling deeply sad and hopeless
Right.
and kind of losing interest in things that you used to enjoy.
Yeah.
You might have trouble connecting with your baby,
Mm-hmm.
but with anxiety, it's more about that constant worry and those racing thoughts and physical symptoms like a racing heart.
So anxiety is more about the fear, and the worry and depression is more about the sadness and withdrawal.
Exactly.
Can you have both at the same time?
Absolutely, you can. In fact, many women experience kind of a mix of anxiety and depression symptoms during the postpartum period.
Now, there's another term we hear sometimes, postpartum OCD. What's that all about?
So postpartum OCD involves having these intrusive, unwanted thoughts, often centered around harming the baby.
Oh, wow.
It's important to emphasize that moms with postpartum OCD are very unlikely to act on these thoughts,
Okay.
but they can be incredibly distressing and they can lead to compulsive behaviors, like constantly checking on the baby.
Right. That must be incredibly scary and isolating for moms going through that.
It is, and it's crucial to remember that it's a treatable condition.
Yeah.
So if you are experiencing these thoughts, please don't suffer in silence. Reach out to a healthcare professional for help. You're not alone, and there are effective treatments available.
Okay, so we've talked about what postpartum anxiety is, but what causes it? Why are some women more prone to it than others?
Well, there's no single answer,
Mm-hmm.
but it likely involves a combination of factors. One of the biggest culprits is that dramatic hormonal shift
Yeah.
that happens after childbirth. Estrogen and progesterone levels just plummet.
Yeah.
And those fluctuations can really, wreak havoc on your mood and your emotional stability.
So our hormones are kind of working against us.
In a way, yeah. And then, you add in the sleep deprivation, which, let's face it, is
Right.
pretty much inevitable with a newborn,
Right.
and the stress of adjusting to new parenthood.
Mhm.
It can create a perfect storm for anxiety.
It's like everything is amplified during this time.
Yeah.
So for all the new moms listening, when should you seek professional help? What are the red flags?
If your anxiety is interfering with your daily life, if it's preventing you from caring for yourself or your baby,
Right.
or if you're having thoughts of harming yourself or the baby, it's absolutely time to reach out for professional help.
Mm-mm.
Don't hesitate. Talk to your doctor, a therapist, or anyone you trust.
And who should you reach out to? Where do you even begin?
Your doctor is a great starting point. They can screen you for postpartum mood disorders
Okay.
and connect you with the right resources, whether it's a therapist, a support group, or other specialists.
Awesome.
Yeah. And the good news is there are effective treatments available.
Good.
One common approach is talk therapy,
Okay.
especially cognitive behavioral therapy or CBT.
Right.
Think of it as retraining your brain to think about those anxious thoughts differently.
CBT, it's like giving yourself a mental makeover,
Right.
swapping those negative thought patterns for more positive ones.
Exactly.
Yeah.
And sometimes medication might be recommended,
Right.
often in conjunction with therapy. SSRIs are commonly prescribed, and they're generally considered safe during breastfeeding.
That's good to know because a lot of moms worry about taking medication while breastfeeding.
Right.
But of course, it's crucial to talk to your doctor to find what's best for you and your baby.
Absolutely. Your doctor can help you weigh the risks and the benefits and make an informed decision. Now, beyond professional help, there are also a lot of things moms can do on their own to manage anxiety.
Okay, give us the goods.
Yeah.
What are some actionable things moms can start doing today to feel better?
Well, first, remember that cuddle time with your baby isn't just for bonding.
Right.
It's a superpower.
Okay.
Skin-to-skin contact releases oxytocin, which is a natural stress reliever.
So snuggle that baby.
Exactly.
It's good for both of you.
Exactly. And I know it's easier said than done, but prioritizing sleep is huge.
Yeah.
Even if it means sleeping in shifts with your partner or asking a family member to watch the baby for a bit so you can catch a nap,
Right.
those little bits of rest can make a world of difference.
Yeah. Sleep deprivation is like anxiety's best friend.
Yeah,
It just makes everything feel worse.
you got it. And don't underestimate the power of connecting with other moms.
Oh, for sure.
Whether it's a local support group or an online forum or just a phone call with a friend who gets it,
Right.
sharing your experiences can be incredibly validating. It makes
Yeah.
you realize you're not alone in this.
Sometimes just knowing that other moms are going through the same thing can be so reassuring.
Exactly.
What about exercise? Does that help with anxiety?
Absolutely. Exercise is like a magic potion for your mood. Even a short walk or some gentle yoga can do wonders for reducing anxiety and boosting those feel-good endorphins.
So snuggle sleep, connect, and move.
Yeah.
Got it. Any other tips?
Yes. This one is for the breastfeeding moms out there. When the time comes to wean, do it gradually.
Okay.
Sudden hormonal changes can trigger anxiety, so a slower transition can help minimize those fluctuations.
That's great advice. I think a lot of moms don't realize how much those hormonal shifts can impact their mood.
Right. It's a big factor. Now let's talk about some tools for managing those anxious thoughts. A lot of moms get stuck in those what if scenarios.
Oh, yeah.
What if something happens to the baby?
Right.
What if I'm not a good enough mom?
Those thoughts can be relentless.
Yeah.
What can you do to quiet them down?
One strategy is to challenge those thoughts.
Okay.
Ask yourself, is this a realistic concern or is it my anxiety talking?
Mm-hmm.
Often those worries are based on fear, not facts.
Right.
And if there is a legitimate concern, think about what steps you can take to address it.
Right.
Knowledge is power, and taking action can help reduce anxiety.
So it's about taking back control instead of letting those worries run wild.
Exactly. And remember, it's okay to ask for reassurance from your doctor or a therapist if you need it.
Mm-hmm.
They can help you sort through those worries and give you some peace of mind.
Now, what about those physical symptoms of anxiety? The racing heart, the shortness of breath. What can you do in those moments to calm down?
Deep breathing exercises are like a secret weapon for anxiety. They can help slow your heart rate, calm your nervous system, and bring a sense of control back to your body.
Okay. Walk us through a deep breathing exercise. How do you do it?
Find a comfortable position, close your eyes if you'd like, and place one hand on your chest and the other on your belly.
Okay.
Inhale slowly and deeply through your nose, feeling your belly expand.
Mm-hmm.
Hold your breath for a few seconds, then exhale slowly through your mouth, feeling your belly deflate.
And you can do this anytime, anywhere, right? Even with the baby in your arms.
Exactly.
Wow.
It's like a portable anxiety relief tool you can use whenever you need it.
Speaking of portable tools, the CareClinic app has some great resources for managing postpartum anxiety. Have you checked it out?
Absolutely. It's like having a virtual support group in your pocket.
Oh, nice.
Plus tons of tips and information on coping with anxiety. Definitely worth a download.
Okay, so we've talked about deep breathing. What are some other ways to calm your body when anxiety hits?
Grounding is another great technique. It's about bringing your attention to the present moment, using your senses. Try this. Notice 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste.
Wow, I love that. It's like a quick reset button for your brain.
Exactly. It helps shift your focus away from those anxious thoughts and bring you back to the here and now.
And don't forget the power of touch.
Yeah.
Cuddling with your baby releases those feel-good hormones that help combat stress and anxiety.
Right. Physical touch is so important for both you and your baby. It's a natural way to soothe and connect.
Okay. We've covered a lot of great strategies for managing anxiety, but let's be real. Self-care can be tough when you're a new mom.
Yeah.
You're sleep deprived, you're overwhelmed, and you're constantly putting your baby's needs first.
Yeah.
How do you make time for yourself?
It's not easy, but it's so important.
Well,
Even small acts of self-care can make a big difference. Think about things that you enjoy, taking a warm bath, reading a book, listening to music,
right.
or just having a few minutes of quiet time.
It's about giving yourself permission to recharge, even if it's just for a few minutes each day.
And remember, asking for help is not a sign of weakness.
Yeah.
It's a sign of strength. Don't be afraid to lean on your partner, family, or friends if you need a break,
Right.
a listening ear, or just a helping hand.
It takes a village.
Yeah.
Right. And sometimes you just need to call in the reinforcements. Now, we've talked about a lot of different approaches to managing postpartum anxiety, from therapy and medication to lifestyle changes and coping techniques. What's the most important takeaway for our listeners? I think the biggest takeaway is that you're not alone.
Yeah.
Postpartum anxiety is incredibly common and it's treatable.
Yeah.
There's no shame in reaching out for help.
Absolutely. And it's important to remember that anxiety can, look different for everyone.
Right.
Some moms experience mainly physical symptoms like that racing heart,
Right.
feeling breathless, while others might have more of those intrusive thoughts or that constant sense of dread.
So it's not one size fits all. And that's where self-awareness is so important.
Exactly.
The more you understand your own anxiety patterns, the better you can manage them.
It's about figuring out what your triggers are
Yeah.
and developing coping strategies that work for you. And remember, those strategies might change from day to day.
Right.
Or even hour to hour.
It's all about being flexible and adapting to what your mind and body need in that moment. Now, before we wrap up, I wanted to circle back to something we talked about earlier. The CareClinic app. It sounds like a fantastic resource for new moms struggling with postpartum anxiety.
It really is. I encourage all our listeners to check it out. It's packed with information, tips on managing anxiety. Plus, it offers a sense of community and support, which is so important during this time.
Okay, so if you're feeling overwhelmed, download the CareClinic app. It's like having a virtual support group in your pocket, plus tons of expert advice at your fingertips.
Exactly. And remember, you are stronger than you think.
Yeah.
You've got this.
That's a great message to end on. You are strong, you are capable, and you deserve to feel better. Thanks for joining us today, everyone. And remember, reach out for support if you need it. You don't have to go through this alone.
We'll be back next week with another episode of the CareClinic podcast. Until then, take care.